Hello to those of you who are tuning in. My name is Brianna Contreras, and I am Associate Editor of Managed Healthcare Executive. Today I have Sara Douglas, lead investigator of the abstract Video Conference Intervention for Distance Caregivers of Patients with Cancer, Improving Psychological Outcomes. Sara will be presenting the details of her findings at the American Society of Clinical Oncology, or ASCO's, virtual conference, which will be held from May 29th through the 31st. Thanks for being here with us today, Sara.
My pleasure.
So first, before we get into the details of the findings about distance caregivers that you're going to be presenting at ASCO's annual meeting, can you define what distance caregivers are?
Sure. Actually, there are a variety of definitions, but the most common one, and the one we used in this study, was caregivers who lived more than an hour travel time away from their loved one or the patient with cancer. So that's the most common definition.
Now, how and why did distance caregivers become a research interest of yours?
Well, we had done some early work in with patients and local caregivers, and we would run across distance caregivers. They'd be calling in to do a conference call with the oncologist and the patient, or they would be making phone calls at the end of the day, asking additional questions. And so we became interested in sort of the plight of these individuals because they're at a distance. They can't come to the office visit. Oftentimes they can't see the patient. They don't know exactly how things are going. And then at the end of the day, oftentimes healthcare providers then are, circling back around to answer phone calls or emails that they've gotten from these people who are involved in the patient's care, but they're not physically there or close enough to get the information firsthand. So we sort of noticed this a little bit and then started doing a little investigation and realized that nobody had really done much work in this field, especially with cancer patients. And given the the distress that goes with a cancer diagnosis, not only for the patient, but for the whole family, we really felt like that it would be important for us to try to see if we could find an intervention that could help reduce some of their anxiety and distress and help meet some of their unique needs, because there are all sorts of interventions for local caregivers, but a lot of times those don't apply to some of the specific issues that distance caregivers have.
Okay, thank you. Now, what questions were you trying to answer with the study that you're presenting at ASCO?
Well, the main outcomes that we were focused on, and that's what our ASCO presentation relates to, is whether or not this intervention that we designed and tested specifically for distance cancer caregivers, whether or not it would reduce anxiety and distress of the distance caregivers. There had been some research done previously by our group and some others that had shown distance caregivers actually have higher rates of anxiety and distress than the patients do and then the local caregivers do. So we were interested in seeing if, having this intervention that was designed specifically for them would do anything in terms of helping to reduce the distress and anxiety they had. So that was our main question.
Okay, great. Can you describe the design of your study?
Yes, it was a randomized clinical trial, and what that means is that we randomly assigned distance caregivers who were eligible into one of three groups, and the full arm of the intervention was the one where the distance caregivers received 4 coaching sessions from an advanced practice nurse or social worker, and those took place through a video conference technology. And they had special emphasis on issues that historically have been of concern for distance caregivers, such as uncertainty, how to communicate with family, how to communicate with healthcare providers. Then we also focused on issues that would be of specific concern for that distance caregiver themselves. So they had 4 of those sessions, individual coaching sessions over the 4-month study period. They also received access. We brought them into the exam room when the oncologist was meeting with the patient at any period of time during that 4-month study period. So they could see the patient, they could meet the physician and see what the oncologist looked like. They could get their questions answered firsthand. If there were scans to be looked at or things like that, the oncologist could show the scans so they could get that information and get their questions answered firsthand. And then the last part was we designed a website with some specific information for distance caregivers of patients with cancer. So that arm was the full intervention. Then the next arm did not get the coaching, but they got the other two pieces. And then the third arm, which was sort of our control group, only got access to the website, so they didn't get the video conferencing in the office visit, nor did they get the coaching.
Okay. Either way, there are some benefits there, obviously, for these patients.
Mm-hmm.
Now, which results are the most important of your findings?
Well, the two results that we're presenting at ASCO, anxiety and distress, are the most important ones. And basically what we found was that for distance caregivers who were in the arm that got all of, the full complement of the intervention, the greatest number of caregivers, distance caregivers in that group showed a meaningful improvement in their anxiety and distress compared to the other groups. Now, we also found that for people that got the video conference and website arm, so that second level, that they also showed some improvement in terms of their anxiety and distress scores as well. So it was a nice result to have, to know that the full intervention did the best job of reducing their anxiety and distress, but that for organizations that may not have the resources to provide an advanced practice nurse or social worker to do one-on-one counseling or coaching with distance caregivers, that even if you brought the video conference technology to the exam room, that in and of itself could help reduce some of the anxiety and distress that these caregivers had.
Great to hear. Now, obviously, telehealth seems to be ready to take off because of the current pandemic going on.
Mm-hmm.
Does your study make a case for more telehealth? I mean, already it seems to be.
Absolutely. Actually, the case that I think we're able to make is that it benefits distance caregivers. But now with COVID-19, what we're finding is in most cancer facilities, local caregivers are not necessarily able to come in with the patient for the office visits or for their treatments, or there may be limits to that. And so people who were used to being able to be there in person and get their questions answered, the local caregivers, they're not able to do that right now. And so even though they're not true distance caregivers, they're cut off from that information. And so I think they can benefit. And I also think there are also local caregivers that work and can't get away, for an office visit that may start an hour later than it was supposed to, et cetera. And so I think there are lots of opportunities for caregivers to benefit. And what we also found, it wasn't a major focus of the study, but what we found was that for distance caregivers who had improvement in their anxiety and distress, that their patients also had improvement in their distress as well. Now, it wasn't statistically significant from a scientific point of view, but it was trending in the correct direction. So,
Okay.
And there has been a fair amount of research that shows if the caregiver feels less stressed, the patient feels less stressed as well.
Okay, great.
Mm-hmm.
Now, lastly, is there anything else that you just you want to share with our viewers that you think is important that they can look forward to during your presentation?
Well, one of the things, it wasn't a research aim of the study, but we were interested in sort of describing the anecdotal feedback that we got from the oncologists in particular, because one of the concerns going in, and rightfully so, is how much time is this going to add to the office visit, because time is precious. And we found that on average, adding video conference technology added anywhere from 2 to 4 minutes to the office visit. So that isn't a huge amount of time. You add that up over 10 or 15 office visits, and of course it adds up a little bit.
Right.
But was not at all, the oncologists who participated were very surprised that they did not feel that the office visit was any longer than normal. They really liked video conference versus a conference call, which is what a lot of people do,
Hmm.
because they felt like they could see the caregiver, that communication was better, they could show them slides or scans, etc. And they also felt, and they just volunteered this information, that for patients whose distance caregiver had been in the video conference portion of the study, they really felt that they were not having to have as many phone calls to answer or emails to answer at the end of the day. So, so the physicians were quite supportive of the intervention, and I think a little bit to their surprise.
Yeah. Well, hopefully, this carries on a positive note and increases in that way because that could benefit a number of people.
Yes, I agree. I agree. And I think, COVID-19 isn't going to just one day go away, at least not in the immediate future. And there will always be reasons that we're concerned about our cancer patients. They're immunosuppressed, they're more susceptible to infection. So if there's a bad flu season or whatever, there are other reasons why caregivers who are not necessarily distance caregivers may not feel like that they can accompany their loved one for a visit with the oncologist. And so I think to have this opportunity to be able to interact and get questions answered, to see for themselves what's going on, I think that's very beneficial. And it's nice to know that it's not only a nice thing to do, but it actually makes a difference.
Oh, definitely. Well, thank you so much, Sarah, for your time. I appreciate you speaking with us and kind of giving us some insight on what you'll be sharing during ASCO. So again,
Okay.
thank you so much.
Well, you're welcome, and thank you for your interest.